In clearing them, do you stop surveying?
Yes, because after, you see, the 21 days is an extreme. We know that usually the illness occurs between the first and the second week, even though we say the incubation period is between 2 to 21 days. So if you actually haven't fallen ill between probably the 8th and the 14th day, there's the likelihood that you won't fall ill. But we'll go through that process until the end of that 21st day. So what we're doing with the 177 that you're talking about now are the contacts of the people who have been confirmed. So we need to follow them up too. And for the next 21 days to make sure that none of them fall ill. And as soon as they go through that incubation period, it's over, we clear them.
What's happening at the primary healthcare level? I mean, is this Ebola message also being transmitted at that level? And what has been people's reception of it?
Yes, it's been transmitted. And again, that's where I keep on talking about the panic. We have 276 primary healthcare facilities in Lagos. And each one of them is being manned by health workers. We've trained them, we've sensitized them. And they're actually playing a very big role in this surveillance we're talking about, because we have duty notification officers at each level of the local government. They're the ones who are actually following this contact, going to their homes, making sure that they are well, taking their temperatures, because what we've basically done is give a thermometer to every contact that we have to monitor their temperature, because like we always say, the first sign of the illness will be a fever. So the primary healthcare system is responding, but it is the general, how do I put it now, the general populace and some of our private practitioners, and they've done very well. I must commend them on that, because about 3 or 4 cases that we've picked up, they were the ones who informed us of those cases. So it is a tough thing, but I think generally the health system is coping, and we hope to keep on coping to the end of this.
But how do you contain or manage those who, for instance, if they're under surveillance, and then you tell them, listen, don't do certain things, don't leave certain areas, and then they go? Or you ask them to call, maybe you give them a thermometer saying, listen, if your temperature goes beyond a certain level, you need to call us. And then some of them don't call, and then they allow other people to come touch them.
There are challenges. If I tell you there are none, then I'll be lying. But majority of these challenges is about who we are as a people. In trying to deny things, we go into a state of denial. We've overcome some of those challenges. We keep on trying to plug at it to make sure that we are able to keep in contact with these people. And so far, as of yesterday, I can assure you that 93% of the people that we need to keep under surveillance, we are in contact with them. And the percentage
93%?
Yes, the percentage keeps on increasing. What we want is that 100% of them every day are followed up, and the percentage keeps on increasing.
Well, I'm sure they're also very worried about the 7% you've not been able to track.
Yes, we are worried. If we're not worried, I won't be saying this.
Okay.
We want to make sure that the 100% of the people we need to track are being tracked. And this is probably a good medium to try and appeal to them that nobody is going to do anything bad to them. What we want to make sure is that they are well, that they do not cause a problem for people who are close relatives to them. Because usually, when you look at this, the 2 sets of people that are usually in danger are close relatives and health workers.
Are we seeking help from any African country that has been through this?
Yes. The World Organization has sent a slew of experts, basically from countries who've had experience, and they're sharing their experience with us. So it's from day one that has always been there.
We have some questions here. I think it would be good for you to respond, tied to the people that have been cleared, as you said. Munad says, some people have strong immune systems, so don't you think one can be a carrier and move about for an extra day or 2?
There's no asymptomatic carrier in Ebola. None. If you are ill, you are ill. If you're not ill, you're not ill.
Okay, so tie it to this, because George says, yes, but Mr. Sawyer was on a flight. He wasn't just walking about, he was on a long flight.
Look at it this way. Mr. Sawyer was in a long flight, but he fell ill during that flight, didn't he? He had been ill. I don't need to really talk about Mr. Sawyer, because a lot of the information that had come in then showed that probably there was something to this, but we'll leave that alone. But the good part of it basically was that Mr. Sawyer fell ill, and it was because he had the disease. And that's the message. You can't be walking about all over the place doing what you normally need to do and have the disease.
Okay, we want to thank you for coming on. Dr. Olukayode is the Permanent Secretary, Lagos State Primary Health Care Board. Thank you for coming on this morning.
Thank you.